I think some of the most common myths is actually related to how to use condom. Many young people think that should be used for prostitutes or unfaithful partners only. The other myth is oral contraceptive pills would cause like cancer. This kind of information come from the doctor themselves, but maybe the lack of counseling.
Hello, and welcome to the Demystifying Healthcare in Vietnam podcast. I'm Beth Ann Lopez, founder and CEO of Docosan. We're on a mission to make healthcare effortless and bring you insights from Vietnam's top players in healthcare. On this week's episode, we're speaking with Ms. Nguyen Thi Bich Hang. Ms. Hang is the country director of MSI Reproductive Choices Vietnam, or MSI. MSI is one of the world's leading providers of reproductive health services, operating in multiple countries and providing various services like contraception, safe abortion, and maternal health services. Mrs. Hang has led MSI Vietnam for the past 25 years. She has over 10 years of experience in the private sector, in business development, and in management. She's tirelessly pursued the transformation of a purely donor-dependent NGO into a leading sustainable social enterprise in sexual and reproductive health in Vietnam. The MSI Reproductive Choices Vietnam program currently serves about 1 million women a year through their country program. They've also helped more than 1.5 million couples protect themselves from unwanted births. It is one of the largest and most successful sexual and reproductive health providers in Vietnam. So, Mrs. Hang, it is great to be here with you today. And today we are going to talk about sexual and reproductive health in Vietnam. And so, in getting started, can you tell us about your journey into becoming country director of MSI?
Thank you for having me today. I think it's very exciting to have a conversation with you, yourself, and Docosan as a group. It was August 1998 when I heard about MSI. And by that time, the name of the organization is like Marriage Stop International. And I heard about the organization. The organization was looking for a person to lead their program in Vietnam as a country director, and I was inspired by, first of all, by the story of Dr. Tim Black, who one of the founders of the organization. Dr. Tim Black, he's a medical doctor, and in the late 1960s, he was working as a district health officer in Sepik districts in New Guinea. And one day, after saving the life of a 3-month-old girl, he was shocked when he saw her widow mother, who already had 5 children, by that time, and had no steady income. And she said she did not expect that her daughter would survive. So Dr. Tim Black later on recalled, and he said by saving the life of that girl, he had actually compounded, not solved her problems. And then I was really inspired by that story. And when I joined the organization, and during the last 25 years, I am so fortunate to come across and to meet with so many women, like million women. And I heard so many inspiring stories of how the women in Vietnam is actually, while experiencing all the hardships, is actually had, made a lot of effort to overcome these challenges in their life, and feed their kids and raise their kids and build the families and become successful women, successful leaders in Vietnam. So that kind of inspiration has been like from the first day, but it's also come with me every single day until today. So that's really inspired me, and in my role as a country director of MSI in Vietnam.
Yeah, I think that's really amazing. And I hope we touch on that like a little bit later in the conversation about, like how women have overcome a lot in Vietnam. And there's so many female heads of companies in government and so many different roles that is like quite inspiring here. And I think other countries can also take a lot of lessons from that too. And so how has the landscape for sexual and reproductive health services changed in Vietnam in the last 2 decades?
During the last 2 decades, the government of Vietnam has actually invested a lot of resources as well as, they really focus on the areas of sexual and reproductive health. And a lot of significant improvement has been made during the last 2 decades. Nowadays, you could probably see that Vietnam, now in 2023, Vietnam population is actually 100 million people. It's quite a big one and a big country. And, 21.1% of the population is actually young people and from 10 to 24. And that is then that kind of demographic windows is actually a huge opportunity for Vietnam to tap on and to accelerate socioeconomic growth in Vietnam. I think, even though the situation has been significantly improved, with all this kind of internet, the awareness of the general population about reproductive health, contraceptions, safe abortion, and other women's health issues has been significantly improved. But it's still, the situation in Vietnam is still the disparities and inequalities in accessing to sexual and reproductive health services. The disparities between the different population groups. So obviously, women in remote rural area, ethnic minorities, migrant workers, and young people obviously had much higher demand in terms of the sexual reproductive health services. And the disparities is also, and inequalities as well, between the population group, like, higher educations, better economic conditions is actually have a much better access to the education as well as services in the areas of sexual reproductive health. Actually, at the policy level, the government of Vietnam has been re-strategizing their health strategy for the country, from their focus on family planning and fertility control to more like a maternal health care, sexually transmitted disease, cervical cancer screening, HPV-related kind of cancer. And just recently, the strategies added in taking care of elderly people as well as aging, because you probably know that Vietnam, the golden population window would soon, kind of pass. And then by 2036, Vietnam would officially become an age population with more than 15% of the people with the age of 65 and above. And so I think the health strategies of the government of Vietnam has been now moving towards that direction, and then to ensure that the needs of that kind of the population group would be met in the next decades.
Yeah, that's quite forward-looking. Because sometimes I talk to friends here visiting from Japan, which has a very large older population and are dealing with the issues of aging and healthcare every day. And they're always very struck by, everyone is so young in Vietnam. There's kids and families everywhere, and so it is interesting to hear that the government is already thinking about kind of like downstream effects as the population gets older too.
Yeah. I think that strategy, I hope that it would help the government as well, investor, to really kind of prioritize their investments in this group in the future. In relation to the reproductive health and sexual reproductive health landscapes of Vietnam, I think the unmet, we have to mention about the unmet need for contraception. Vietnam has been making a lot of efforts in fertility control for, I think, during the last 25 years since I joined the organization. And 7 years ago, Vietnam reached the level of fertilities in Vietnam, reached the level of replacement. And so I think now Vietnam start facing with all these kind of agings, or in some areas, especially in the big city, young people do not want to get married, or even they don't want to have a kids as well. So I think the fertility control policies is now need to be adjusted. But in Vietnam, there's still like 21% of the women of reproductive age actually have unmet needs for modern contraception, which equal like 3.4 million women who need modern contraception, either for spacing or for prevent unwanted pregnancy a year.
And what do you think are the biggest barriers that are affecting that 21%?
There are many factors, and I think among the women of reproductive age, the unmet needs is actually 21%, but also among young people, that the unmet needs for modern contraception is actually 36%. It's very high, and I think there are some factors. On the one hand, I think it's like education, awareness about the availabilities of the methods. And also there is a lot of myth surrounding this kind of which contraceptive method is suitable for them.
What are the common myths? We've heard this a little bit too from patients coming through Docosan. Sometimes we hear things that kind of surprise us, like, oh, if you take hormones, like it'll affect your reproduction later. But like, what are the common myths that you've heard?
I think some of the most common myth is actually related to condom, how to use condom, and they many young people think that condom is actually should be used for prostitutes or for unfaithful partners only, and also men. There are many kind of anecdotal stories about men negotiating with the prostitutes of not using condom. Because they think that it's actually affect the kind of the sexual pleasures, etc. The other myth is related to like oral contraceptive pill. The oral contraceptive pills is many young people believe that using oral contraceptive pills would cause like cancer, cervical cancer.
Wow.
Yeah. And
where did they get these myths from?
I don't think this kind of information come from the doctor themselves, but maybe the lack of counseling, and most of them they talk to each other. They talk to each other about these methods. And also many women think that contraceptive implant is not a good method because it causes no periods, and no periods means abnormal. It can cause some health problems as well. Many myths surrounding that, and so I think these are one of the factors that prevent many women from using certain kind of methods. For example, when we brought our education, sexual and reproductive health education to the factory floor, and we offer the supporting services, and we talk to the young female factory workers, and I talked to 10 of them who came for an implant, contraceptive implant service, and then I asked them, how many kids do they have? And 9 out of 10 said that they have 3 kids. And 9 out of 10 said that the third one is actually unwanted. Only one confirmed that, oh, my husband family really want to have more kids, and that's why I have the third child. So I think there are so many things so many factors that prevent them from using certain kind of method. And so you could see that in Vietnam, the method mix already changed significantly. It used to be like 70% of the married women actually use IUD for a long time. But then they switched to the short-term methods. They use condom, they use oral pill, and young people, most of the time, they choose emergency contraception. Is a really, really big sale volumes in Vietnam, very popular. So I think that kind of behavior is actually a very important contributing factor to the fact that there are so many unwanted pregnancies that ended in abortion as well in Vietnam.
Yeah, I see. And why do you think that it went from kind of the trend of most women using longer term contraception like IUDs to now something really kind of short and reactive? Like there's a lot of side effects if you regularly take emergency contraceptive.
Exactly. And then I think it's partly because I mentioned about the awareness and the myth, but it's also the other factors is that the availabilities of the methods at affordable price, availability of service provider. So in terms of the choice, they have very limited choice in terms of method as well as the service provider. And I think these factors acting together is actually contributed directly to the high case of unwanted pregnancies in Vietnam.
And I think that's something that us as like healthcare practitioners should also really keep in mind is, I think about how it's so easy to go to any pharmacy in Vietnam and you can pick up, oral contraceptive pills and emergency contraception, which is really great compared to it not being there. Like I think about in the US, there's so many barriers. You have to get a prescription. They just make it really hard and unaffordable. You can't just walk into a pharmacy and get what you need. But then at the same time, just by having that be the most available thing and having a low level of awareness, it's kind of like deterring, or maybe not deterring, but like people don't realize that there are kind of like safer, longer term methods to do family planning.
That's right. Yes. And I think, I could talk a lot more about, other limiting factors like, the high price of contraceptive implants like Implant-On Next. Which is now the service costs a woman about more than $100, $120. And that's a big amount of money for many of them. For low-income women as well. And also there are not many health facilities, including the facility as well as private facility, that offer that kind of services. And there is a whole areas of, licensing, certificates, and, training to make sure that they have adequate knowledge and skill to do counseling as well as the providing services. So I think these are the important limiting factors to the choice of women in the areas of modern contraception.
Yeah. And I imagine almost like privacy must have a role in this too, because I think about if you end up going to a public hospital, just how incredibly crowded it is. Like there's virtually no privacy, right?
Yeah, right.
And then if you're talking about something so sensitive, like, like sexual reproductive health,
you
don't want everyone in your neighborhood to know your business.
Yeah. I think many kind of anecdotally mention about the fact that because of the lack of counseling in the public sector and in most of the private sector, I think private sector nowadays improve a lot because they see the need to do the thorough counseling and instruction to their clients so that they don't have to come back call them maybe at night for any kind of help. And that's why, but in the public health sectors, it's still, the high caseload and so I think I don't have that kind of accurate figure, but you could see that even in the US, the average time that a doctor spends with one patient is actually range from 3 minutes to 6 minutes only. And so, they certainly do not have enough time to talk and for the patient or for our client to ask their question. Then I think that's one of the reasons why they walk away at the health facility, still confused, still don't know what to, and that led to many kind of misuse of the products as well, and did not follow the regime. It's actually caused them failure, and they ended up with unwanted pregnancies and abortion.
Yeah. And I know that this is a big issue that you guys are helping to change too through your chain of private clinics called Dr. Marie. And I know these are also like quite popular on Docosan too. You've got clinics all across the country that specialize in sexual reproductive health services. And so how is like the experience at a Dr. Marie clinic different from the status quo that someone might usually get?
I think the difference between our Dr. Marie clinics and in fairness to the public health facilities and private health facility is that we follow the global standard of MSI, and primarily in the areas of infection prevention. I believe that infection prevention in Vietnam is an urgent. I believe it is an urgent. And it's a serious issues of both public and private health facilities as well. So infection prevention to ensure the safety of our services. And I think the second difference is actually we operate in a principle and a philosophy that we would never over prescribe or over service. We just focus on the needs, maybe the needs that maybe sometimes the client are aware of their needs, but also there are the needs that they're not aware. Then we spend time and talk to them and make sure that they understand their needs, and also they are willing and voluntarily use other kind of treatment as well. But we never... It's our principle that we never over prescribe and over service. So that the second difference. And I think in terms of the technical skills, I understand technically the private health sectors, those doctors who work in the daytime in the public hospital and after work at their own facilities. I think those people, they probably still have the opportunity to update their knowledge as a part of the public health system. But those who already retire and they work on their own and they are not considered, I mean, technically they are part of the health system, but in reality, they are not. And that's why they tend not to be updated with the knowledge and skills and all this kind of counseling skill for their client or for their patient. And that's why there's a serious issues in the quality of care, but it's also compliant to the clinical standards as well. We implemented various programs. We piloted some model like a government social franchise and private social franchise in Vietnam as well. And we always started with the kind of evaluation of all aspects of service provision from, the infrastructure, the readiness of the infrastructures and medical equipment for service provision, the skills and knowledge and qualification of service provider, and also their skills in interaction with the people, with their patient as well. So we have a long list to evaluate this, evaluate the readiness as well as the quality of their services. And when we started, it's always like there's no big difference between the public sectors and the private health sector. We started our government social franchise model in 2005. And the model lasted for 10 years.
And what do you mean by government social franchise model?
That's a model. It is a quite popular model in the health sectors, but also in the development sector. Instead of it borrowed the main principle of commercial franchise, right? But here's it's kind of social franchise. So most of the time, with donor financial support, we invest in the health facility. We have a kind of standard training program for service provider. And it's just not just one-off. It's every year. And then MSI was the franchisor. And then we design the health facilities, and we designed the standard training programs, and we recruited the brand ambassador, train them, and so they can go out to the community to talk about the brand and encourage the people in the community to come back, because the utilization of the health services at the community health station level was just like they always operated like a 20 or 30% of their full capacity.
Oh, wow. I didn't realize it was so low and that's such a contrast to the cities, right? Where it's completely, people come in from the countryside.
Exactly.
And it's overloaded versus.
And there are many reasons, but I think primarily because the people in the community do not have a trust with, on the level of qualities and the capacity of service provider, etc. And to be absolutely honest, over the time, even a midwives or even not OB/GYN, but mostly like senior midwife, she could provide a lot of services, kind of maternal care, a lot, and family planning services within the community health station. And they have been utilized to do all these kind of other things. It's not their specialties, and that's why the level of the trust is very low, and that led to this kind of the low level of utilization at the public sector. And it's just a huge waste of the resources, and it causes frustration and incur costs for women in the community, because whenever they need any services, they'll go up to the districts or even the provincial level for services, and they go to the private sector.
Right. And you guys have such a different perspective in that you started out as a NGO and you had to, go through getting donor funding regularly.
Yeah.
It's a very different kind of like model. And then under your leadership, especially, you transitioned to a true business, a social enterprise model. And so how did that come about, and how did you achieve this?
Yeah, I have to say that MSI in itself is already. When I first joined Mary Stokes, and my first conversation with Dr. Tim Black is that, MSI is not a charity. MSI is not a pure NGO. I would rather call MSI as a social enterprise. And he explained what was a social enterprise. And a social enterprise is a kind of we utilize all the modern kind of management technique to maximize social benefit, social impact, rather than commercial impact. But also commercial, like financial results, is also very important for us, because donor will never be there forever. And, there's no point that we become the friends of women where we operate, and then we would not be there for them when they're in need, right? So the ideas of building the financial sustainability, so that we can last many, many years after donor funding is already there from the very beginning with Tim idea. But I think the fact is that when NGO has a lot of money from donor, so MSI was very successful. Like 5 years ago, they were very successful with large donors who actually kind of provided a very big grant. And they say they were so nice. They say, okay, we like your mission. We like the way that you work and deliver services. Here's the money. And do whatever you think that it's the best, in the best way. But that kind of philosophy is from the very beginning. And I have to say that I find it very inspirational, because I came from the private sector, and I could not imagine that, for any business, even a social business, we just spend money and then start day, end day, and that's all about that. So the ideas of running the organization as social enterprise actually encourage us to focus on innovation and critical thinking about, the productivity, efficiency, effectiveness of our activities, and what kind of sustainability. How can we sustain the program even beyond donor funding? I mean, so in every program that we design, we always have to have a kind of post-donor funding sustainability plan. So you could see that our first clinic that we set up in Nghệ Vinh City in 1994, and it's still there, serving people and very successful.
That's really amazing. And I guess, like, how do you balance the social impact mission that you guys have and some of the stuff that don't necessarily immediately get revenue, right? Like, so counseling a patient,
exactly,
it takes more time of the doctors who are, the most expensive, like, part on the payroll. And so how do you make sure that you keep doing those important?
That's a great question. I think MSI, most of MSI country program has been structured in a way that we have a kind of different channel, different business unit, like our Dr. Mary Clinics channel. They are supposed to serve the higher mid-income and higher income women and charge for full fee and generate surplus. And this kind of surplus is actually reinvested in our program, like serving ethnic minority women, or serving the low-income factory workers who cannot afford kind of full fee services, and also serving the poor people. And we recently invested a lot in serving people living with disability, and we help the people, the victims or the survivor of gender-based violence, etc. That's how we keep delivering our social impact by, making surplus from our Dr. Mary. But we also have another business unit. We call it our social marketing. The social marketing channel and our clinic channels, actually, they are considered as a fully commercial, and they generate surplus, and then they reinvest in our social kind of high impact program.
MSI serves about 1.5 million patients a year, which is a huge amount. And so can you share about, like, what types of services are the most in demand?
5 years ago, we work with the public sectors and private sectors, and we improve their capacities, and we provide this kind of ongoing technical support to them to bring essential services to women in their own communities. Nowadays, MSI serve women through our clinic channel, Dr. Mary. We also help our kind of more than 2,000 customers who are OBGYN, private clinics, and private hospital and public hospital to bring more quality product and services to their communities as well. And, it really depends on the age group. Each of the age groups have a kind of certain needs, right? So, women of reproductive age is actually need this kind of gynecological examination and treatments, contraceptives, and nutrition, things like that. But it's also the younger group would need like a menstruation health counseling, as well as we are working with our digital marketing team to really make a breakthrough in the mind of the people about the very first gynecological check, because that's a very good opportunity for us to start with like a teenager and to talk about many other things like safe sex and relationships and contraception before they actually start doing that. So it really depends on different age group. At our Dr. Mary clinics now, like 65% of our client age within the age of 22 to 35, 37, and 40. And so we are expanding into teenager. So start talking to those women who come to our clinics and who have a teenager girls, and about, you think about, providing some kind of counseling to to your daughters and about her mental health, and how she could practice in a way that can keep her like healthy, and also find out if there is anything not normal at an early stage. So, but it's also in Vietnam there is the service that are most in demand is actually contraception. It used to be abortion, because abortion in Vietnam, even though it's still quite high, but there is a tendency that women do it like a home administration, although it's not legal, but it is increasing.
By home administration, is it kind of like unsupervised, unsafe, or like what is?
Yeah, you could say that. You could say that, but many of them kind of go to the pharmacies and buy the drugs, and come back homes and use this kind of instruction to do it at home. So you could say that unsupervised, and I think that become very popular. We talk a lot to pharmacists nowadays, and they say, well, they sell quite many. So obviously, women seek for that kind of alternatives rather than going to hospital or even the private clinic where they have the chance to be seen by acquaintance or other friends, or and also the cost as well. The cost is normally much higher, so they tend to have a home administration.
And so what kind of prompted that shift from abortion being the biggest service to contraception? How did that happen?
I think one of the training course in our standard training program for the private and public service provider is actually post-abortion care. And post-abortion care includes the post-abortion contraception. Most of the time they do not provide any kind of counseling on what kind of contraceptive that a woman should use after that. But it's also like, some private provider think that, okay, if I provide that kind of counseling, then, and if they are successful with contraception, we would not have any, they will not come back in a long time, So repeated abortion is actually an issue in Vietnam as well. So I think that's one of the reasons why, because, not many women who went through the abortions procedure understand that, okay, they can easily get pregnant again in 14 days. Many of them do not know that. And if they are not if their doctor did not tell them about that, how would they know?
And so education and awareness is so important. And what are the main sources that people are getting education and awareness right now?
I think nowadays people can, young people can easily Google, internet or anything, any information. But they still talk to each other quite a lot. They share their experience as well. And we have to say that there's a reluctance and there is a concerns about the accuracy of the and reliabilities of this kind of information. So I think many people, or especially young people, even though they are kind of technology savvy, they can Google anything, but they still, that kind of myth. They also face with the myth as well. And they probably do not have the opportunity to talk to professional and to get that kind of official counseling or, official information and knowledge.
I know healthcare information, it can be overly technical sometimes, hard to understand, and it's certainly hard to contextualize too, right? Yeah. And so I guess I'm curious too about how do cultural and social norms in Vietnam in particular influence the uptake of sexual and reproductive health services?
I think that I personally think that the situation has been improved a lot. I mean, whatever people say, whether it's kind of influenced by the Western culture, but I think nowadays, for example, many parents feel that it's acceptable, probably not preferable, but acceptable to have their own sons or daughter. I mean, and they past like 18 or the age of 18 or 20, that they can move, kind of move out and live with their partners. I think more and more people accept that, especially those parents who have the kids that go overseas for study. And I think, even those many parents nowadays feel that it's okay for their daughter, for example, to use modern contraception. But I guess that many of them don't have that kind of knowledge and skill to talk to their kids about that.
Like, is it common? So in the US, we kind of have this almost like kind of like trope where it's like, okay, you have the talk about like the birds and the bees with like your middle schooler. Is it the same in Vietnam?
Not. I don't think so. I mean, only those parents who already have the knowledge as well as the skill to talk to their kids about that. And like a father talk to son, how to still enjoy their relationship, but without making the girl pregnant, for example. I don't think that many of them do that. But more and more people do that nowadays. And I think they seek for information. But also, I think, there is a tendency that, many young people delay marriage. Or if they get married, they delay having a kid because they say, well, the big kind of responsibilities, and they rather not having a kid and focus in developing their career, etc. And I think this over the time has become like a tendency. The age of marriage in Vietnam among women it's stay almost the same during the last 10 years at about like 23, 24 average. But for men, it's actually increased from 24, 25 now to 29, 30. Yeah. So men tend to delay marriage more than women. And I heard that some even public health facilities, some public hospital, they explicitly refuse to provide the abortion service. They said, we don't do that. We no longer do that. And then our question is that, okay, no woman wants to have an abortion because it is a very traumatic experience. But if they got that kind of unwanted pregnancy, where should they go?
Yeah, if not a hospital, what are you supposed to do?
Exactly. Yeah. Should they go to the back street abortions and, they do all kind of thing on their own, and it's certainly kind of it's not safe. So that kind of So I would not say that is the culture of Vietnam, because abortion has been there for a long time, and we most of the people want to kind of the 2-child policies, and they are all quite familiar with that, but it comes from many doctors and many professionals nowadays, and I think it's probably push the young woman to go to the pharmacies and buy medical abortion pill and do it at home.
And what do you think needs to be done to, I guess, like, I don't know if it's like educating the providers but to I guess like advocate and show the need just for the availability of like basic women's reproductive health, right? Like there shouldn't be huge barriers for anyone getting medical help.
I really don't think that there is a kind of explicit agenda of the Ministry of Health to do that. And I think, they should deal with that. They should face with the reality. But I also think that, you could see that we could never get reliable data on abortion cases in Vietnam. Different statistics, there's a huge difference among, these statistics and this way. And the main reason is that I think some of the some of the health officers who work for Ministry of Health actually shy away from that. And they probably think that, it's like we need to save our face by not saying that we have a. So most of the time they say, no, abortion cases actually decreased significantly, but we don't have reliable statistics to prove the point. And different organizations say different things.
Probably not a lot of will to or want to
yes,
have such detailed data, and it is difficult for politicians too, because it is such a controversial issue, and if you take a stand on that, then maybe that's kind of what you're known for.
So I think it should come from and if it is not, I call it reality checks. If they do not have a kind of the real picture and they don't know where the problem is, how can they solve the problem? And I mean, let alone the fact that they do not want to kind of acknowledge that that's the situation. But I think MSI have one of our standard program. We have like a training of service provider on, changing their mindset about abortion, whether there is a very fine line between like aborting a spirit rather than saving the life. It's just a very fine line between that. And that's why we believe in saving life, because, no one wants to have an unwanted birth. And yeah,
absolutely. And can you share any success stories in particular that stand out in your mind from your work at MSI?
I think MSI has been initiating and piloted quite many business model or intervention model into the health to solve the health problem in Vietnam. So, for example, we piloted our government social franchise at the community health station level to improve the quality. But it's also to improve the awareness of the population and, bringing supplies and demand together. We consider, like Vietnam, our government social franchise model, sisterhood, was considered as the very first and successful intervention program into the public sector. And it was recognized by the international audience in some of the international conference on social franchise. And we were successful in changing, kind of turning the people around in the community to increase the client, the service uptake from, as within the range of 25% to 40%, which is a huge, because within 10 years, this is a huge change. And many of the health facilities nowadays, for example, in Thanh Hoa, they keep going and they become, very successful model where they have, the choice of their community. For example, they have a district hospital, which is only 500 meters away. But like 80% of women in the community come and deliver in their facility rather than there. So, and also another success story is our improvement of the clinical quality, the compliance. And you probably heard that Vietnam has a serious problem of like a non-compliant to the steps in diagnosis and treatment.
Huge variability.
Yeah. Well, I remember like 10 years ago, and I was shocked hearing from my colleague at WHO in Vietnam, and she said, you know what? Like 47% of the diagnosis by the doctors in Vietnam are incorrect.
47%. That's huge.
47%, and that means in many cases that would be killing people rather than saving their life.
It's basically a coin toss at that point.
Exactly. So, we, our kind of the baseline, we call QTA. QTA score means quality technical assistant. We use, a lot of criteria to evaluate the quality and primarily the clinical quality. from infection prevention and to kind of customer care and follow-up, etc. And, averagely it was like a 45, 47%. And after 3 years, it's actually for the public sectors, because, we had to negotiate it with the public sector to provide more medical instrument for them. So it took us a little bit longer time. But 3 years, we reached the level of 86%. So from 47, 45% to 86%. And in 5 years, so every year it's kind of incremental, but, after 5 years, 95%.
Yeah, that's amazing. I think about like how difficult it is to change an organization, let alone a healthcare organization where you're
exactly
dealing with,
yes. And it's a long process of not only changing the practices, but it's also the mindset, the behavior as well.
How did you guys do that?
We have a donor funded program, and we train them for the first time. We have a refresher training after 6 months. But most of the time, we develop the so-called local supervisor, and we train them in, supportive monitoring. And then we go every year. And every year we do competency assessment for service provider. And so there are 3 levels. Level 1, those who are the service provider, level 1 can provide certain services without supervision. Level 2 need to be supervised by level 1 or by the local supervisor. And level 3, we recommend, you are not going to provide service. Mm-hmm. So it's by doing that, then we actually, and over the time, they can leap up from the level 3 to level 2 and then level 1. And, we work on a kind of incentive scheme. And we piloted all of this, and then we share the tools, we share the lesson learned with the public health sector. And in some provinces, we were even successful in negotiating with the People Council to issue the price list for the services. Because, women in the community, if they're not from the poor household, because those women who are from poor household, they are entitled to free services. But those who are not, then they have to pay. But then if they want to have an IUD or they want to have a gynae exam, then they have to pay. And they are willing to pay. We conducted a survey, 70% of the women in the community are willing to pay. But, there's no policy for them, no price list. And then the service provider would say, okay, we can't charge you. We can't provide services to you because we have no policy. We have no instruction that we can collect this payment. And then what can we do with this payment?
Yeah.
Yeah. So I think these for government social franchise as well as for private social franchise. For the private social franchise, we not only improving the quality, improving the customer, the client satisfaction. Client satisfaction is like, 60, 70%. And after 2 or 3 years, and then net promoter scores is actually like 89, 90. So which is the huge jump. But in the private sector, we also successful in providing more choices of method, because the arrangement with the private sector is more flexible. So we could provide them with commodities. We could provide them with like an implant, contraceptive implant, and then have a service contract with them. Say, okay, if you provide that service, these are our costs, and you can keep this and money. And you have to guarantee that you could only charge this to the women. And so after 10 years of working with under the program at government social franchise and private social franchise, we managed to build like a pool of service provider. Like now we have like a 3,000 level 1 service provider, public one. in all kind of provinces where the unmet needs are high for modern contraception, we can easily mobilize them. And if we have a donor funding, then and we can deliver service immediately and at a much lower cost than any other service provider.
Well, it's very amazing. And you guys have been able to be successful, not only in terms of having a big social impact, but in building a successful clinic chain and sustainable businesses. And so do you have any advice for future aspiring entrepreneurs that want to take on big issues in healthcare or in their communities?
I don't know whether I can give any advices. Every organization is different. I understand there are so many NGO nowadays, not only in health, but in other sectors as well. They are transforming themselves into social enterprise. And I think it is not an easy path because, offering your product or services to the communities need, time to build your credibilities, but it's also to build or to identify your kind of target customer and, approach them and make them understand about, your product or services. And I think most of the other NGO, except for the health, because I could see that there are only a few NGOs who work in health in Vietnam. And I think probably MSI probably is still the only one who involved in direct service provision. So, but I think it would take time. And, the NGO should really utilize or maybe change their mentality, change their mindset towards kind of business oriented, treat them as an entrepreneur, to be innovative and, to understand their customers. And I think, many NGO, even a big one, they are very serious about setting up their own social enterprise. And I think, the first question is that if you are an entrepreneur, what kind of value that you are going to bring to the society and who need them and who is willing to pay? Ask themselves this question. And I think for health, kind of social enterprise, I think there are so many opportunities here in Vietnam. And I think it's just a matter of finding their own niche market and finding their role, identifying their role, because I believe that nowadays there's no way that one organization can serve everybody and can do everything. And that's why, nowadays things like the partnerships or leverage marketing is very critical for them. And I think, like us, we constantly talk to other partners and try to find the common interface, kind of intersection, so that we could work together and we can leverage our client database and expertise, etc. And I think that's how we could grow together. And that's the only way that we could, as a group, that we can solve a health problem in a sustainable way, I believe.
Totally agree with that. And then finally, how can our listeners get involved with the important work that MSI is doing here in Vietnam?
I really think that because of our quite small network in Vietnam, we are serving, like our clinic network serve about like 50,000 women a year. And we certainly want to, Dr. Marie really want to become a top mind brand in the areas of women's health in Vietnam. And we really want our listener to take care of their own health, and starting with the knowledge and information, prepare themselves with the correct information and correct knowledge, and make their own decision about their own health. Because I believe that many women in Vietnam still cannot control their sexual and reproductive because of many reasons. So get yourself to become a smart woman, understanding about your health, and seek for quality service provider, and take control of your kind of fertility and take control of your sexual and reproductive health. Our listener can actually visit our website, www.drmarie.com, for more information. And we would be very happy to serve them in the future.
Fantastic. Well, thank you so much, Mrs. Hang. This was you guys do such incredible work at MSI. And our listeners can find the link to MSI's website in the description, as well as the link to the Dr. Marie Clinic chain that they can book via Docosan. And so thanks for listening, and tune in next time for the next episode of Demystifying Healthcare in Vietnam.